Hi everyone, it's Karen, and I'm going to get started right now with sharing the blood supply and nervous supply in the lumbo-sacro-iliac area. So we've got neurovasculature that's really clinically relevant and important to yoga teachers. So I'm going to get stuck right into that. We talk all about the structure of the lumbo-sacro-iliac region in our webinar, and you can access that webinar through the link in the newsletter. But now looking at the neurovasculature. So here we have in red an oxygenated blood supply coming through the descending aorta. And the aorta is a really muscular vessel with its layers. It can pump blood, and it works through the system in a very active way to supply the system with blood. So it's part of the systemic blood supply, and that gives the aorta a really al dente kind of texture, so its shape holds under pressure. But its neighbor here, its mate, the inferior vena cava, that carries deoxygenated blood going in the opposite direction. So that blood will be coursing superiorly, whereas the aorta carries blood coursing inferiorly. The vena cava is a very flimsy vessel, and all of the veins are much flimsier because of the limitation in their layer. So that one layer, the tunica of the vena cava, it's very flimsy. So we don't want to have any extra weight pressing on the vena cava. So that's the major reason why we keep pregnant women out of supine positions during their third trimester. And you can imagine that the woman herself would feel uncomfortable having the weight of the pregnancy and the expanded internal organs pressing down on that flimsier vena cava, because that's going to prevent blood supply from returning to the heart. Okay, so just a little discussion on how the vessels course out of the pelvic bowl and over the pubis and over where the pubis is continuous with the ilia. So we have a region called the femoral triangle. And the femoral triangle is important because it contains the neurovascular bundle. We have the femoral artery, the femoral vein, and that's going to be all bundled up with some important nerves. So if we layer in some of the nerves, you can see that, that the blood supply often courses with nerve supply. So indeed, you have a femoral nerve, a femoral vein, and a femoral artery. The artery is in red, and again, the blue means it's a vein. Okay, so those main supply lines of nervous information and the communication of blood, both deoxygenated and oxygenated, is going to pass through this femoral triangle. And you can see that they're very intimate with the psoas. And all of this is bundled up, bound intimately with the fascia that ensconced within the fascia. We have the movement of gliding muscle layers and muscle compartments. So you've got directionalities of the psoas, and all of that is ensheathed in the fascia that it functions best when it is gliding, when there's that sense of movement in between the layers. And when the pectineus, which is the floor of the femoral triangle, when that is locked in and embedded with fascia that is tight and doesn't have the souplesse and give to it, then we don't have as much mobility in the area, and there can be a lot of pain here. The therapeutic application of pressure in the femoral triangle is related to blood stops and returning more functionality to this region through the application of pressure, therapeutic levels of pressure, and then rhythmic decompression to allow and to encourage the flow of circulation, both the flow of information circulation and of blood. Also, the fluid matrix will be happiest when it can move through an area that's nice and free and gliding. So there's a nice view into that, the lateral aspect of the medial lateral view of the femoral triangle. Okay, so that is the femoral vessels, and then these are known as the external vessels, because this is the region of those vessels that takes the vessels from deep or internal to external or more superficial. So these are the external iliac artery and then the external iliac vein there as well. What I want you to notice is the level of bifurcation here around the sacral promontory and L1. Right, and so that's our very whistle-stop tour of the neurovasculature of the lumbo-sacral region. So close to being just 5 minutes, but it's a bit over. Thank you. I hope you've enjoyed this. Please keep in touch, and anything we can do to support your learning or offer a another tutorial, then please let us know. Have a great day, everyone. Bye.